Hello, beautiful people. Welcome back to the channel. Today we are going further into atrial fibrillation, aka AFib, and the potential triggers. So today we're going to go over things that could be triggering your atrial fibrillation because more often than not, people are being managed through medication alone, which this is nothing against medication, but if you don't also know the potential triggers of your AFib, then there is a piece missing of management that could be done to potentially reduce the need for those medications or just better manage your AFib in general. And for those of you who haven't watched the first episode I did on AFib, I do highly recommend watching that one first because that's where I introduce the condition a little bit more and start talking about some of the more common triggers like inflammation and infection. Today we're going to go over some of the things that are even less discussed, but just keep in mind that you don't necessarily have all of these things. But what I'm hoping that you get out of today's episode is a wider understanding of the potential things that could be causing or triggering your AFib so that you can look into those things further, go for further testing, figure out a way to manage those potential triggers, and again, see if that helps in any capacity. You probably don't have everything, but usually people have one or multiple of these triggers that can be managed. And these are things outside of the typical medication or ablation surgeries that are typically offered for AFib. And again, no harm, no shade on those things. It's just they're not the only options. Okay, so before I get into the bulk of today's episode, I should probably introduce myself to those of you who've never watched my YouTube channel before. My name is Dr. Robin Lewis. I'm a naturopathic physician practicing in Vancouver, British Columbia, Canada, and let's get into it. The most basic understanding of AFib or atrial fibrillation is that it's an electrical conductivity problem of the heart. The heart is sending weird electrical signals that are causing your heart to beat faster all of a sudden and just act inappropriately. So that's the simple way of looking at it. But what is driving those electrical shifts and those changes? And so one thing I wanted to start out with talking about is toxins. So this is usually a vague wellness term that people sometimes think is just trying to sell you a detox program. But what I'm trying to look at are measurable toxicants. So these are things that you can actually see in specialized urine or blood tests, for example. And often they are things like air pollution, pesticides, and heavy metals, all of which have studies linking them to things like rhythm and electrical problems inside the heart. So one study that I looked at was looking at more of the air pollution, these fine particles that will get into your bloodstream through your lungs. And there are actually quite a few different studies that link high air pollution with increased rates of atrial fibrillation and any electrical conductivity problem. The good news in that particular case is we have things that can reduce our burden. No, I might not be able to move out of the busy city that I live in, but I can at least look at buying a high quality air filter so the air I'm breathing every day while I'm sleeping and hanging out at home is at least less toxic than the air around me. And so a lot of these things you can actually do something about. The next thing I want to talk about are the heavy metals because these ones are super interesting but very poorly understood. Now, most of us don't think about heavy metals in our day-to-day lives. This could be things like lead, mercury, arsenic, cadmium, or even relatively common minerals like aluminum. The reason they're so poorly understood is because it doesn't have to be a huge exposure. What happens often, more often than not, is it's a series of little exposures over time. And the reason this is a problem is because heavy metals, more so than most other toxins I can think of in the environment, do not excrete very easily. So they accumulate in the body over time. So it's not necessarily something that you have to have a huge exposure of all of a sudden to start to see problems with. These small exposures accumulate over time, and what they can begin to do is replace your healthy minerals inside the body. And that's because minerals in general, heavy metals, calcium, zinc, magnesium, All of these things have electrical charges associated with them. And so sometimes you can see similar charged heavy metals replacing your healthy minerals like calcium and magnesium. So a good example of this would be magnesium. Magnesium is typically a 2+ charge, meaning it has a positive +2 charge. Lead also has a positive +2 charge. Now, of course, they're not the same things, but they're charged the same way. And this doesn't always lead to issues, but if you're deficient in something like magnesium, which is actually very common as a deficiency, then you can start to see the lead replacing the magnesium inside the body. Now that's going to create a huge problem because lead isn't supposed to be there. So it gets replaced because the body's starved of these minerals and it's kind of taking what it can get. And that replacement is actually going to cause a lot of detriment because lead is not necessarily good, especially in places like your cardiovascular system where it creates a lot of inflammation, a lot of oxidative stress, and a lot of these toxins can actually cause damage to the ion channels that are responsible for electrical activity inside the heart. So this is how we put together the dots. It can be a slow accumulation of things like lead, for example, over time that is just leading to a problem because maybe you also have a mineral deficiency, making it easier for the lead to create problems. And so then we're going to discuss minerals later on, but just note that it's very common to have certain mineral deficiencies, and it's not as uncommon to have heavy metals as you might think. What most people don't realize is heavy metals can be found in a lot of different places. So sometimes it's in certain cosmetics, it can be found in certain herbs and spices due to growing in contaminated soils. You can see it even in the tap water of older homes that still use lead piping. You can see it in a lot of imported goods where they're maybe not regulating the processing as tightly. So a lot of imported like candles and paints might still contain some of these heavy metals. You can see it accumulate in fish, for example, because it's not going to excrete very easily from any organism. So say the fish has been living in contaminated waters, well, that might get stored inside of its tissue and now you're eating the fish sort of thing. That's why pregnant women are asked to avoid things like raw fish. It's not the only reason. There's parasites and stuff like that, but it could be an unhealthy exposure to things like mercury, which is definitely not good for the fetus. So another reason that someone might be extra cautious around things like that. The point is, not everything has heavy metals by any stretch, but there can be little exposures over time through various different ways. And for some people, that's going to lead to huge problems down the line. One study I looked at actually looked at pre-treating with mercury. So say what they were trying to emulate was if you have higher than normal amounts of mercury, for example, will you have worse outcomes when it comes to a heart attack? So a lot of people develop something like AFib after a heart attack. All the damage and destruction associated with that heart attack has also created damage to the ion channels, for example, or there's scarring that affects electrical activity. Either way, very common to develop heart rhythm problems after a heart attack. And having higher than normal amounts of mercury, for example, in this study, predisposed people to more AFib after the heart attack, which makes sense because these are charged things. They are definitely going to affect the electrical activity of your heart. So heavy metals can be a really big issue. You just need to test them appropriately. So not a very good test to be done through the blood. The blood mercury levels, lead levels, things like that will almost always come off negative, especially if you haven't been acutely exposed to that thing. So if it's not still in your current environment, it's just stored in your tissue from years ago, that's not going to get picked up on a blood test. So this is where you can do provoked urine testing. I'm not going to go into all of the nuances here because it could be a whole topic in of itself, but just know there are ways to properly test it. Blood is not a very good way to test heavy metals. And if you do show up high for things like mercury, lead, cadmium, aluminum, for example, you're going to want to do specialized treatments to help get that out. And so that'll be all that I say on heavy metals. Okay, so this is probably a pretty good place to talk about the good minerals. So I'm mostly going to focus on magnesium and potassium. Magnesium is such a good example. This is such an important mineral and very much relates back to AFib. And so magnesium, for example, will generally speaking calm the electrical activity of the heart. It's doing this by modulating how calcium enters your cardiac cells, which is going to have a direct impact on the rhythm and things like atrial fibrillation. And even so, they have been using magnesium in emergency settings to help calm AFib in the moment. So they've studied magnesium IVs in more of an emergency context for AFib and found it to be very effective. So that's the studied, very well documented version of using magnesium. What they've also found is just generally being deficient in magnesium does put you at a higher risk of things like AFib. So this is where supplementing magnesium over time could be very helpful. And that's assuming you're deficient, which is actually quite common. So magnesium is used in like about 300 or more enzymatic reactions inside the body. So it's heavily used up. And things like stress, poor diet, certain medications, even low stomach acid, for example, all can create a magnesium deficiency. So it's actually quite common. And if you want to learn more about the nuances associated with the different types of magnesium and things like that, you can check out my video that I did on magnesium just by itself, because there's actually quite a few different forms of magnesium. And depending on which one you get, some would be very helpful in the context of a magnesium deficiency and some wouldn't. So if you want to check that one out, it's called "Is the form of magnesium that you're taking helpful or a waste of money?" So I guess that's a little bit of a hint about some of the forms being a complete waste of money. And the last thing I want to mention on this topic is how to test magnesium. So typically speaking, a magnesium deficiency won't show up if you just test blood magnesium levels. It will in very extreme cases, but often you can have a normal blood magnesium and still have tissue deficiencies. So it's measuring what's in the blood, but not what's in the tissues. And so something like a red blood cell magnesium, which is a different test than just magnesium in the blood, it's talking about magnesium in the red blood cell. That test can be a more accurate reflection of tissue levels. So if you really want to know whether or not you're deficient, that would be a good test that's fairly well validated. And there's a lot of companies out there that will test different minerals and nutrients. Some have really good testing methods, some have not so good testing methods, but at least the red blood cell magnesium is fairly reliable, and most people will recognize that as a deficiency if that shows up as low, and then that's a good indication to start supplementing with magnesium, especially if you have atrial fibrillation. Potassium is very similar to magnesium in the sense that too little means an increased risk of AFib. And so this one is typically measured through the blood and often done in response to certain medications. So there's a lot of medications that have been shown to reduce people's potassium, sometimes into life-threatening lows. So certain diuretics used to control blood pressure could do that. Certain medications like prednisone or other steroids used to control autoimmune conditions or inflammatory conditions could do that. Certain asthma medications. There are quite a few different medications that can drop your potassium and put you into an increased risk of AFib. So it's always good to check if you're on one of those medications, certainly to have your blood levels of potassium regularly checked, because it is highly associated with AFib if low. The next thing we need to talk about is your thyroid health. So the thyroid is the gland at the base of your throat here that releases thyroid hormone. Thyroid hormone is best known for like metabolism and things like that, but it heavily affects your cardiovascular system. So it affects your heart rate, your blood pressure, and your vascular tone. And so a lot of the times you see AFib associated with an overactive thyroid, aka hyperthyroid. And about 14% of people diagnosed with hyperthyroid have atrial fibrillation, which is a large amount. The other thing to note about that is they're basing that on something called TSH, which is the test they use to flag most people's thyroid conditions. So TSH stands for thyroid stimulating hormone, and it's what a lot of doctors will run in your blood to see if you have a thyroid condition. But that's just one out of the many thyroid markers. So another fun fact is that they estimate about half of the population with a thyroid condition are undiagnosed. So a lot of these people have a thyroid condition and they aren't diagnosed. They don't know about it yet. And I think part of the problem is that they're only running things like TSH. That's just one of the many markers that you can run to look at the health of the thyroid. So you see this a lot of the times in autoimmune thyroid conditions, which means your immune system's attacking your thyroid and creating the thyroid problem, which is actually quite common. And so in these cases, I've often seen people have a normal TSH. But when you run the additional test, like the antibodies, so antithyroid peroxidase or antithyroglobulin, both are autoimmune screens of the thyroid. Oftentimes I'll see those show up as elevated with a normal TSH, often in the earliest stages of developing that thyroid issue. So these are people who, if you just go with the standard testing, are never going to get caught because they have a normal TSH. It's the other markers that are abnormal and flagging to the doctor or healthcare provider, hey, there's a problem here. And if your immune system's attacking your thyroid, it could very well be overstimulating it and leading to an AFib trigger. This is not a naturopathic thing. This is very well documented. If you have really extreme versions of this, it's almost a guarantee you're going to have some heart rhythm problem. And so this can be low grade, undiagnosed. And if you haven't had it looked at yet another area to consider, especially if you're currently exhibiting other signs of a thyroid disorder, like struggles with energy, struggles with weight, not knowing why your weight's swinging, it doesn't make sense. Changes to temperature, skin and hair can be heavily affected by thyroid. So the point is, it's another thing to look into and could be potentially causing your AFib. Okay, and just a few more conditions. There's a lot to go over here, but I'm gonna try and quickly whiz through some of these last ones. So you're getting there, guys, but holistic medicine is complicated. There's a lot of different things that could trigger things for you. So the next one I'm gonna talk about is less common, rarely discussed, but is very important to consider. And that is things that relate to histamine. So this could be histamine intolerances, mast cell problems, IgE allergies. So the point is, having too much histamine is the theme of all of these conditions. So for example, one condition called mast cell activation syndrome relates back to the mast cells. Your mast cells are a specific type of immune cell that can release histamine. Your heart actually has a lot of mast cells within its tissue. And so when these mast cells get stimulated, they release histamine into their environment. And that histamine is typically associated with a lot of allergies, like seasonal allergies, for example, sneezing, runny eyes, things like that. Or sometimes it's related to allergic reactions like anaphylactic and stuff like that. But what most people don't realize is that histamine can affect the rhythm of your heart. It can affect your blood pressure, it can affect your heart rate, and it can disturb the electrical activity of your heart in more extreme manifestations of a histamine problem. There are even animal studies that confirm that cardiac histamine can trigger a dysrhythmia in these animal models. And so if you are someone who has like a mast cell disorder or chronic allergies and just elevated levels of IgE, you are more likely to trigger your histamine and have too much of it. So there's a lot of different parts of this pathway that can go wrong. You can have too much histamine coming into the body, so too many histamine-rich foods, too many exposures to allergens, whether they be environmental or food allergens. You can have really sensitive mast cells that are really easily triggered and dump your histamine too quickly. You can have troubles clearing that histamine. Honestly, this is a very big topic that could be its own topic in of itself, but it's one of those things where if you have too much histamine, it can have knock-on effects on your cardiovascular system among a lot of other systems. This is quite a spectrum of conditions. Some present mildly with just a few allergic-like symptoms like runny eyes and stuff, or it can be like full-blown anaphylaxis every other day, big swelling, big skin rashes, big problems. And so it's a spectrum. Histamine is a naturally occurring substance, but if you have far too much of it over time, it can lead to problems of the cardiovascular system. And arrhythmias are just one of those cardiac problems that are potentially driven by too much histamine for far too long. And one of the final things I want to talk about is the topic of sex hormones. So this could be things like estrogen, progesterone, and testosterone. The key point from all the research that I found is that it just needs to be balanced, right? Like you don't want too much or too little. And there's a lot of nuance to hormones. So really either extreme ends are not good for cardiovascular health. But one thing that was fairly consistent is that the rates of atrial fibrillation definitely increases when women go through menopause. So you can assume the estrogen has a very protective role here. So that's one overarching theme that seems to be consistent. I would argue too little estrogen or too much estrogen, especially the wrong types, probably not great either, but definitely that drop in estrogen can heavily affect your cardiovascular system. It can drive blood pressure up. It can lead to a lot of issues, one of which is increased rates of atrial fibrillation. And so it's a good idea to have a lot of support when you're transitioning around perimenopause and menopause, because these things can be managed much better, but a lot of us aren't doing that because you just don't know to do that. Another thing was too much testosterone. So this could be people who are taking testosterone and just taking excessive amounts of it. Again, not monitoring to make sure that you have healthy levels. You're going into the extreme levels, because too much testosterone, high levels of testosterone, especially in older men, has also been associated with increased rates of atrial fibrillation. So hormones are another great place to kind of explore. If they're not being managed well, aka you have other signs of hormone issues, or you've tested your hormones, which is nuanced as well, and found they're low or out of balance, then that can be another area to work on to hopefully better manage your AFib and I guess just overall health. So in today's episode, I hope I helped you understand how broad the different types of triggers could be and give you just a little bit of empowerment that these are things you can have investigated by your healthcare providers. Mind you, hopefully properly investigated. So if we look back to the thyroid example, sometimes your doctor's like, yeah, your thyroid's great. And then you look into it and you're like, well, that's just one of the many markers you could have looked at. Can we please expand that? You know, sometimes with hormone testing is a really good example, like thyroid or testosterone. You can look at total testosterone, which isn't that helpful, but if you look at bioavailable testosterone, that's much more helpful. So all of these little topics could be expanded upon, but that's really where it comes to you guys being your own health advocates and really kind of taking it upon yourself to make sure these things are properly ruled out. Because if they are a trigger for you, there's things you can do for each of these problems. You can balance your hormones, you can get your thyroid under control, you can balance out your minerals, you can start to take a magnesium, etc., etc. There's lots of things you can do here, guys. I hope that's empowering for you to hear. Thank you again for listening. If you have any comments, if you have any personal experiences or questions related to today's topic, by all means, please comment them below. And thanks for the continued support.